What's up, y'all? This is Dr. Jewel, and I am so excited to partner with Yes Lord Radio in my new radio show, Ask Dr. Jewel. I'm a doctor of nursing, a professor, a clinician, and your go-to for all things pertaining to mental health, mental wellness, and mental illness. Look, y'all, just call me America's MHS, Mental Health Specialist. So look, you all, it's time. It's time to get your minds right with Ask Dr. Jewel. Oh, here we go. Hey, JB, how are ya?
Hey, Dr. Jewel, so good.
Man,
so glad to be
man,
here.
It's good to be in the land of the living one more time. You
Come
know
on,
what I mean?
I know
I'm
that's
just
right.
saying it. Look, we've got some things to talk about today, and you know what I'm talking about? You know what the topic gonna be today?
What's it going to be?
Your mama.
Now, you know those are fighting words.
Yeah,
Dr.
I'm gonna
Jewel.
talk
Your
about
mama?
your mama.
Wait, my mama?
No, not your mama, but everybody's mama. I'm talking about your mama. I'm talking about people's grandmama, okay? Nana, Mimi, G-Paw, Uncle Freddie. I'm going to talk about your family today, okay?
This generational.
Oh, my
problems,
generational. Ain't that what y'all calling in Memphis?
I mean, when we were really getting spicy and froggy, we would say your whole generation.
Not just part of it, but your whole generation.
Your whole
Oh, yeah,
generation.
y'all was trying to be deep. Well, you know what? We're going to talk about your whole generation here at Ask Dr. Jewel. And you may want to say, you know, Dr. Jewel, why you not being nice? Like, what's going on? You being a mean girl? I'm really not. I want to talk about your family and your family's relevance to your mental health, JB.
Yes,
you know,
yes.
I want to talk about the fact that as a primary care provider, I did a lot of work, you know, in clinics and seeing patients for a little bit of everything. But you know what? One thing that I did, you got to get a family history.
That's
when
right.
you go to the doctor, don't they ask you about your family history?
They do that whole social history. I tell you.
Absolutely. You smoke, you drink. Like, what do you do? What are your habits? You know, what's going on? But then they ask about your family history because we realize that there is a genetic predisposition to certain diseases and illnesses
Yeah.
based on the fact that, you know, who you were born to.
Come
And, you know,
on.
we don't have no choice in that. We have no choice in that. But, you know, you go look at your mama, you kind of look at her sideways and be like, I got that from you. Oh, my goodness. You ain't nothing you can do about it, but you got it. So we ask about family history because it's important. So who do we ask? We ask, you know, does your mama have hypertension, cancer? You know, we mark those things off, and then we look at it to kind of predict or be able to kind of see where are you going? Where are you leaning towards? So when you have certain signs and symptoms of those things, you know, we see that blood pressure coming up first. We want to know, mama, daddy, grandparents, siblings, who has it, you
So
know?
we got to ask some questions.
Yeah, you do. You got to get nosy. You got to ask some questions. And, you know, everybody in your family don't want to tell you things. You know, you see, you like, wait a minute, something wrong
I
with
know
you.
mine is secretive. I tell
You know, so you know,
we don't share anything.
in the vault. You know what I mean? So you out here on these streets having stuff, and they could have told you. You could have been working on it like 10 years, and they trying to be all secretive. So the moral of the story is, you know, we got to start talking about this, JB. We got to look Uncle Willie in the face and say, Uncle Willie, you know, do you have, you know, you got that tick on the side of your head. Do you have like, what's going on with
right.
you? You know, Mom.
You done had gout for 20
You
years.
see what I'm saying? And then all of a sudden my toe hurting and I'm wondering, you know, do I have gout? And ain't nobody talking. Everybody closed lipped. Ain't nobody talking about it. So, you know, we got to talk about these things. I'm going to turn the corner and I'm going to deal with mental health,
Yes.
JB, because you know what? We need to know your mental health history.
That's
We
right.
need to go and talk to our family members. Now, you know, you go to the family reunion and you got that cousin talking to people that's not there, and you sitting there, you're like, wait, what? You know, and everybody's like, girl, don't worry about him. That's just your cousin. That's just how they are. No, we may have something there.
Having a whole party.
You're having a whole party
By
turned
themselves.
up, ain't nobody else there. And you know, that's not normal. So the thing is that you could have schizophrenia in your family, okay? I had someone tell me the other day that was in a mental health crisis. They were, you know, they heard voices and different things like that. And then they said, you know, I talked to a relative of mine, okay? And I was talking to them and I hadn't talked to them in years, but I was having this crisis and I thought that this relative could help me, okay? The relative was a part of the ministry. And they said, when I talked to them, they said, you know what? I have the same thing.
Wow.
And so it could have been running in families and you don't talk about it. When your mama, didn't get out of the bed. She spent months, and you're like, Mama, why are you so sad? Why are you crying all the time? Why, you house a mess, dishes piled up, and you wonder why Mama, she seems physically capable, but her mind won't allow her to do certain things. And Mama had depression. She didn't call it that. She was just low, sad. You assign something else to it. Yeah. But she had depression. So then when you start having lows, JB, you're like, wait, hold on. Is this like in my DNA? Like, what's going on? Is this something that I learned behavior? Like, what is happening? But I say all that to say, JB, we have got to start talking to our families.
That's right.
To find out. So when you are dealing with your mental health, please don't leave out your families. Go back 3 generations, yes. Okay? Yes. Go back to your grandparents. I ain't just talking about mama. I'm talking about your daddy's parents. I'm talking about maternal and paternal grandparents, yes. Your parents, and your siblings. Another time that I see it, JB, it's like focusing. So many people have problems focusing, and a lot of people have misdiagnosed attention deficit disorder.
Uh-oh.
Okay?
Say more about it.
Can't remember anything, can't focus. It's hard for you when you were coming up through school. This could be you. You can be like, Mama, I'm so mad at you. I'm hiding fish streets with you because you should have got me tested. But the moral of the story is you're in school. You can't focus. You're jumping all out your seats. Your teachers are so mad because you disrupt the class. This is your student that when you say something, they finish your sentence, they blurt out, they're just totally impulsive, can't control it. They just cannot control it. Then, like they can't focus. They go home, can't do homework. Their rooms look like the Tasmanian devil. I mean, stuff everywhere. They can't stay organized. Book bag is a wreck. They forget homework assignments. I mean, these are your kids. They forget everything. You tell them to do something, go upstairs and take your shoes upstairs. Honey, them shoes right there, So they forget.
So it's not that they're being defiant all the time.
Come on now. It's not that they're being defiant, JB. It's the fact that they actually forget. ADHD is a neurodevelopmental disorder. That means it happens at birth. I mean, it's just there. And so as a result of that, you have certain problems of focusing, executive functioning, okay, in your prefrontal cortex. So it's a part of your brain that deals with how you're able to prioritize, how you're able to focus, how you're able to pay attention. That is compromised. So you have these symptoms. And then what you do, you just want to jack them up and be like, I'm sad, screaming at them. And these babies can't help it. But what I'm saying is that I see a lot of that.
Yes.
And the parents have it. Okay. And so the parents was like, I was like that. So I'm missing a lot of valuable information as a result of you not doing that family history and seeing what runs in your family. So if your kid has a problem, look at yourself, look at daddy, okay? Ask daddy whether you're with him or not, honey. Go ask him about his parents, his siblings, and see what's going on possibly with your child. We need to go back and do that family history. So history matters, you all.
So, Dr. Jewel, I hear you saying history matters. Is it all about mental illness, or can you pick up like being mean from your family members? Just being nice, nasty, just passive aggressive?
Whoa, JB, that is a good question, man. Oh my goodness. Yeah, you can pick all that up too. And when you're dealing with we call it your genogram, that's kind of how we look at your generations and just kind of see who's got what. When you're looking at mental health and wellness, I want you not just to look at mental illness. Okay, yeah, they may be depressed. They may be hoarders. Those are all diagnosable mental health conditions, but they may be mean. Okay, they may handle situations. They're screamers. They throw things. They have violent kind of behaviors. They're moody. Okay, they don't have to have a mental illness to have some issues. So when you're looking through your family history, you all, take some time to do this. I want you to look at a couple things. Okay, go ahead. For each family member,
so, are there some steps that we can, or some signs that we can identify to help us do our genogram, if you will?
Yes, it is. Okay, so this is what you're going to do. All right, so take your mama and your daddy, okay? And I want you to ask yourself a few of these questions. Ask them, okay? First, just think about how they impacted you. So these are some of the questions I want you to ask, okay? First of all, I want you to give like 5 words to describe that family member. So like JB, like you were saying, my mom is nice. She was anxious. She was fearful. She was compassionate. I need you to write down the 5 things that you know about your parent.
Can I add sanctified, filled, fire baptized?
Yes, you can put all of that, okay? Put that in there as well, all right? Now, I also want you to ask, how were they when they were angry? Okay, you want to say, were they did they take a lot? Were they very, very aggressive in the way that they act? Were they mean? And so I want you to know that, because if you're like that, I need to know where it came from. We got to go back and trace that thing. I also want you to ask, how did they handle conflict? Did people like them?
Oh, wait now.
Come on now. I'm talking about mental health and wellness. I'm dealing with, what's going on with them. Did people actually like them? Okay. How did they make you feel? Did they make you feel safe? Did they make you feel fearful? Did you feel threatened around them? How did they make you feel? I also, were you close to them? So when you're going through your family tree, I need to look like this. Mama, close. Daddy, don't know them. Granddaddy, close. Grandma, I need you to put that down there. Your relationship with them. I want you to put down there, how did other family members characterize them? They was meaner than a snake. They were the drama king. I want all of that in there. We're dealing with mental health, okay? I need all of that in there, because a part of mental health is behavioral. It's how you handle emotions. It's how you think. It's how you react. All of those things, okay? That's a part of mental health and wellness. I also want you to ask, what was their role in the family? Okay. Were they the protector? Were they like the matriarch, the one that everybody went to? Did everybody go to their house? I want you to kind of look at what drove that behavior. And I also want to look at their strengths and their weaknesses. What were they good at? What were they not good at? Okay.
Budgeting, saving.
Oh, come
spending.
on now. Come on. What were their thoughts about money? Where did that come from? Okay. Were they spenders? Were they very thrifty? Were they selfish? What are some of those things? And because they're rooted in something, JB, mental health and wellness is bigger than what we think. Okay. So we need to know that. And were they mentally well? We need to know that they have any mental illness. So tag that along. I put that at the end. It's not that it has to be at the end. Some things are more obvious, like do they have a mental illness that's diagnosable? But some of the other things that I ask about, what was their role in the family? How did they treat you? How did they make you feel? Are you close to them? Are you not? That can let you know. Or if you go through and see all of your siblings, you don't have a relationship with them. Why? What's going on? We need to see what's going on in that family. So when you go to your therapist and you're struggling with your mental health, when you're trying to figure out, why don't I feel loved? Why don't I feel valued? Then we can look and say, okay, you're not close to anybody in your family. Why? We can trace that back. Were you betrayed? Was there some type of abuse, trauma? What happened to drive that? So your family history matters, JB. It matters. So I want you to go back and do a deeper dive. Don't take things at face value. Dig through it. See how your family members are and see if that could be driving you to maybe not be the mentally healthiest that you could be. Makes sense, JB?
It makes total sense. And it sounds like that will help us all to not suffer in silence.
Oh my goodness. Or suffering in silence, or suffering and don't have a clue as to why. Go back and look at that family history, JB. It's important, because you know why? Because it's time
to get your mind.
Hey, you better ask somebody.
Right.
Get your mind right. Ask Dr. Jewel. We'll see you back in a moment. What's up, JB? We're back again with Ask Dr. Jewel, and thank you for tuning in to the second part of the show. And today we're going to talk about one of my favorite rappers.
Who is it?
Oh my goodness. I know I'm going to get in trouble for this. I am so sorry. I know I'm going to, JB, we can't shame in mental health. We got to be able to be authentic. Okay?
No judgment.
Okay, no judgment. But there's a song out by Megan Thee Stallion, and it's called Anxiety.
All right now.
Oh my goodness. Have you heard it?
You mean Monday, Tuesday, Wednesday, Thursday, Fridays?
Yeah, that one. They have bad days too. Yeah. Friday, Saturday, Sunday, bounce back. How a bad girl always do. All I really want to hear is it'll be okay. Bounce back, because a bad girl can have bad days. All I really want to hear is it'll be okay. Bounce back, because a bad girl can have bad days. What you think about that song?
I mean, sometimes we really do need to hear that it's just going to be okay.
Man, it's okay not to be okay, but
Yes.
you can bounce back. But what I love, JB, is that she's gone through a lot in her life, and anxiety seems to be prevalent. And it is the number one mental illness in this country.
Wow.
So I thought it was very courageous to create a song about anxiety, because anybody can have it. But today, JB, I want to talk about social anxiety.
Uh-oh.
Yeah, I want to talk about those people that have social anxiety out there. Being around people. You fear social events. You fear things where you feel like you're going to be scrutinized, ridiculed. So I want to talk about social anxiety, JB, because it's a major deal. And so, some people ask, Dr. Joel, how do you get this thing? Like, when does it show up? So let me give you a little bit of stats around it, okay?
Yeah.
First of all, it shows up usually when you're around the age, the median age is about 13. Okay. And so you'll get that thing. About 75% of individuals have an age of onset between 8 and 15. So I want you to, if you're older and you're like, you have anxiety, social anxiety, I want you to go back and look when you were a kid, okay? And see, was this an issue, okay? But what happens is that sometimes it comes from a childhood history of trauma, of ridicule, of, parents saying you're nothing, you're horrible. They had a very traumatic event where they went before and did a play at school, and they were ridiculed, and people said things to them, and it gave them an aversion that they have never gotten past, okay?
Yes.
But I want to talk about social anxiety because I want you to know whether or not this could be something that you're struggling with. So the question is it more prevalent in males and females? Well, it does show that it's a little bit more prevalent in females, JB. Do you know anyone with social anxiety? Do you remember growing up? Did you ever have social anxiety?
I think I might have, and it probably started my first time giving that Easter speech.
Oh my goodness, what happened? What'd they do?
I broke down. I could not get it together. I cried the entire time.
Yes.
And, folks would say, well, we'll just pray through it. I am 5.
Come on. Hey.
I don't even know what to do.
Right.
I just know I need my mom and daddy to come up here and help me.
Absolutely. They were like, you need the Holy Ghost. And I mean, honey, we all need the Holy Ghost. Hey, we do. But the thing is that you don't understand that. And so you are having fear, actual fear about doing this, fear and anxiety about social situations. And so that's what, when you're looking at social anxiety, you are really fearing social situations. It causes you immense fear and anxiety. So
it might not be that the person is being bougie or standoffish or they just think they're better than everybody else.
That's right. They actually, right. Because you know what? If you're at a job, a place of employment, and they do those group activities, we're going to go out and we're going to socialize, and you're about to have a panic attack. Matter of fact, you're thinking about it for weeks. If they put it on the schedule in May, honey, we are in February. You are starting to have fear about it and anxiety about it already. Social anxiety, you have a fear of being, now JB, we got to deal with what you fear with social anxiety.
Yes.
Usually you fear being ridiculed. You fear being looked at, devalued. There is something that you've attached to the way people perceive you that gives you a whole lot of anxiety and fear. You're afraid that they're going to point out a flaw. You're afraid that you're not going to do something well enough. And so you have all of these fears. And so you don't want to do things. You avoid any situation that people may be able to look at you, critique you possibly. They may not even be thinking about you, but you have this in your head that people are looking at you to really ridicule you, to value you, to say that, you're not worthy, to say what is wrong with you. Look at her hair. Look at this. Look at that. You think that you actually are being really almost a public display, and just you are the target of people's criticism and ridicule. So it causes you great anxiety, JB. And so the thing is that what often happens with that type of anxiety is that you avoid.
Yes.
I don't want to go to the event with the team. I don't want to go to the restaurant. I don't care how fancy it is. I don't care about the trip that you're going to take everybody on. I don't want to go because it brings about a lot of anxiety being around people. Am I going to say the right thing? You know, when I go out to eat and I'm going out with my boss, am I going to say something stupid? Am I going to drop my fork? Is something going to happen? Am I going to use the right spoon? Am I going to, what are they going to think about me? And so that drives a lot of social anxiety. And so I want to say to people that have this type of anxiety, I just want to say that, you know what? You're not alone. Okay, there are a lot of people that have social anxiety.
Okay, so Dr. Jewel, examples and non-examples really help me to process.
Okay.
So let me ask you a question.
Okay.
Say it's time. Me and my girlfriend have been dating for quite some time. It's time to meet the parents, and we're about to go to Thanksgiving dinner. Mm-hmm. And that's huge.
Yeah,
because everybody, once you start bringing somebody to Thanksgiving dinner, you are on display.
Yes, you are. Like
so
a trophy.
If I just feel a little bit of butterflies, a few butterflies in my stomach, I'm not going. I just kind of feel a little nervous about it. Is that social anxiety?
Oh my goodness, JB, that is excellent. That is a excellent thought. No, JB, that is not social anxiety. That is just normal jitters, okay? So I don't want us to start assigning something that's not really there, okay? Mm-hmm. And so, social anxiety is when it's not occasional. It's all the time with social situations. So it's not just about you worrying about your potential's family. It's about you concerned about going to the coffee shop. It's about you going to work. It's everybody looking at you from everywhere, okay? Being scrutinized by everybody. Your thought process moves in that way that everybody's looking at you. Everybody's scrutinizing you. And it causes immense anxiety and fear all the time, okay? So it's not occasional.
So it sounds persistent, pervasive, and debilitating.
Very debilitating because you know what it does? It causes you not to do. It causes you to withdraw. Okay. Oftentimes I say it snatches your voice. So a lot of people with social anxiety, they're in the corner. They're very quiet, very soft spoken. Don't, kind of disappear and fade. They don't want to be seen. Okay. And so you've got to watch that. Now, another thing that we need to look at is what does it look like in kids? Because I said that it kind of the onset between 8 and 15. Okay. Yes. So the thing is that what does it look like for kids? And so it could look like them crying, having tantrums, freezing, clinging. You've seen that kid that just clings to their parent when they're out. And, the parent's like, get off of me, go speak, go whatever. And that child is absolutely terrified, because they have some type of social anxiety. A lot of them do. Some of them, they may grow out of it. You just don't know. But the thing is that why do they have the social anxiety? We have to dig through that. And we have therapy. They can go to therapy. We can work through what could be driving it and giving them tools how to handle it. Okay. And so have you seen that? You are an educator, JB. Have you seen that in schools with your students?
Such a great question, Dr. Jewel. One thing in my program as a special educator, my professor always said, all behavior communicates. So she really taught us to be very in tune to some of the actions that our students would display in the classroom. And I noticed, especially around field trip time, sometimes students would want to hang back and feel like they couldn't breathe, they couldn't speak, they couldn't even move. And it was beyond just being shy. It was just that fear of being around their peers in a new space. It could even have been just attending a new class and being thrust into being around peers that may not look like them or perform in the same way or be as verbal as they are. And it would be so crippling that you might see them crying. I might have to take them outside and kind of talk them down. And it was so pervasive that they would also often shake and cry and not be able to focus during instruction. So I had to learn that I can't just be like, you know what, why are you not participating?
That's right.
You need to get it together. This is not the place nor the time. You are too old and you should be so much more mature by now.
Come on
this
now.
This is unacceptable behavior.
Oh my
And really, I had to actually do some introspection too, Dr. Jewel, because
Yes, always.
I think I might have been projecting because
Oh.
I had some social anxiety. And I was seeing it in my students, and it was like looking in a mirror.
Wow, JB, that is real talk. And so if you're an educator out there, you have that student. I know many of you do. Just take a look at it. Look at it differently. They actually could have some social anxiety. And we don't even want to deal with the cultural ramifications of that
Lord.
because racism, being the only child of color in a
Yes.
space and feeling like everybody is looking at you, watching you, monitoring how you talk, what you wear, what you do, okay? And so we've got to be careful about that and monitor that. And then I want to bring up one other thing, man, that performance anxiety, that is a subtype of social anxiety where you get stressed out and fearful of performance. So whether you're a dancer, whether or not you're a musician, whether or not you are an actor, whatever it is, when you have to perform, all of a sudden you have this serious anxiety. And so it's something definitely, to look at because these types of anxiety, look, when we look at what it can lead to, how does it look? Man, a lot of people with social anxiety are alone. A lot of them do not get married. Okay, they do not have children. They have such great fear. It messes with their socioeconomic capacity because again, the thing is that they usually don't want to work around a lot of people. Okay. And so you have some people that can kind of find a job in there. They may be your people that are your computer specialists, people that like to work alone. Okay. So my baby, if you like to work alone because you have social anxiety, that's all right because you've learned how to manage it. Okay.
Yes.
But you also have to look at the fact that there are some things that they deal with, like functional consequences of social anxiety disorder. And what that means is that there are some things that happen with people that have social anxiety that may not be common to a general population. And so, for example, did you know this, JB, that people with social anxiety often have an elevated rate of dropping out?
Wow.
Yeah, because employment, workplace productivity is usually lower as a result of social anxiety. Their socioeconomic status is impacted, and just their quality of life overall. A lot of them remain single. Okay, they choose not to have families. They're unmarried. They're divorced. So a lot of these things follow people with social anxiety, and so we've got to deal with it. But look, I want to revisit one more thing before we leave the show today. You said something about, look, we're dealing with children of color because we want to make sure that we deal with cultures, ethnicities that are underrepresented and who we don't really lean into some of these conversations. So I want to talk about social anxiety in our children of color. As an educator, tell me what you're seeing, JB. Take us out. What are you seeing with our children of color with anxiety?
Well, one, it is critically important as an educator that we are socially conscious. We are aware of a lot of the cultural funds of knowledge that our students bring to the space, and that we're also creating a safe space and environment for all students to thrive. So that may actually look like a student, they're not just shy. They may actually need to step outside of the room because they feel sick to their stomach when you call on them. So maybe provide another opportunity to respond to a question in a different manner. They may not feel comfortable in group work. There may need to be some independent processing times where it's actually okay to not be verbal and always be the life of the party because you know what? They're just struggling to just sit in class and just be.
Absolutely. And especially if they're a person of color, they're the only one. And so you call on them for everything, to get their perspective, which I understand. But hey, they may have an underlying anxiety. So you need to be sensitive to that display. And so, look, JB, thank you so much for your input. Thank you for sharing, being an educator out here in these streets, seeing this day in and day out. Good to have you. And you all, look, I hope you learned something on the day. I hope you learned something about anxiety, what to look for, and to also get help for that. Okay, there is help for that. Sometimes you need medication, Jesus, and therapy, honey. And then grandmama and them, honey, that family history is something else. So make sure that you check that family history to kind of see why you are the way that you are. So when you go and talk to a therapist, you can say, you know what, here's my stuff right here. I need you to see how G-Pa act, Nana, all of them, okay? Call them all out, all right? Because you know what, y'all? It's time. It's time to get your mind right. And look, shout out to Yes Lord Radio. Thank you so much for this platform. We love you. And JB, what? Your whole generation. Take care.
Oh, it's time to get it right. Yeah.